Are you struggling with sexual problems and not sure whether to be a sexual therapist or a psychologist? So in this enlightening video, we break down the key differences between these two types of professionals, helping you make an informed decisions about your mental and sexual health. Did you know that nearly 40% people experience sexual issues at some point in their life? Understand and explore who can help with these challenges. Join us, we explore the unique expertise each specialist offers, the types of sexual issues they address, and the treatment approaches they employ. Whether you are dealing with relationship challenges, sexual dysfunction, or any emotional barriers related to intimacy, understanding who to consult, believe me, this can significantly impact your healing journey. So I am promising here by end of this video, you will have a clear understanding of the role of a sexual therapist in addressing sexual concerns and the focus of psychological or emotional and mental health issues, when to seek psychologist on emotional and mental health issues, and some of the tips I'm going to also give. So don't let confusion hold you back from getting the support you deserve. Watch this now to empower yourself with knowledge about your options and take the first step towards a healthier, happier you. Did you know that nearly 1 in 5 adults experience mental illness each year? Yeah, that's a staggering number, right? But what if I told you choosing the right therapist could make all the difference in your healing journey? Today, we are diving into the world of mental health professionals, specifically comparing sexual therapists and psychologists. So who should you see? Let's find out. It's super important, believe me, to pick up the right one based on what you need, whether you're dealing with relationship issues, sexual concerns, or broader mental health challenges, or understanding the two roles will help you make a more informed choices. So stay tuned. We figure this out now together. Now here is a common dilemma. Many people feel very confused when deciding whether to see a sexual therapist or a psychologist. It's like standing at a fork in the road, not knowing which path to take it. Like choosing the wrong therapist can lead to frustration, wasting time, and even more emotional distress. You might ending up like discussing deep-seated issues with someone who do not understand or doesn't specialize or misunderstood or unheard. So let's break this down and clarify things a little more bit clearly. So what exactly do these professionals do? Sexual therapists focus on sexual related issues, that is to sexuality, intimacy, and relationship. They are trained to help with things like sexual dysfunctions, disorders, intimacy issues, and other issues related to even sexual identity concerns as well. On the flip side, psychologists deal with a broad range of mental health issues from anxiety, depression, trauma, and to other behavioral problems. They are equipped to handle emotional and psychological challenges. Often, they use talking-based therapies and various psychological and evidence-based, tools and methods. For instance, if you are struggling with performance anxiety in the bedroom, a sexual therapist might be your go-to. But if you're dealing with the anxiety that's impacting your daily life, and a psychologist could be the better choice. I hope you understood. Now, here is a big insight I know you have been waiting for. The key to making this decision lies in understanding your specific needs. If your challenges are primarily related to the sex or intimacy, a sexual therapist will likely provide a targeted support you need it. But if you're facing broader emotional issues or any mental health concerns, a psychologist could be the right one. So it's all about assessing what you actually need help with and choosing accordingly. To wrap it up, sexual therapists focus on sexual and relational issues, while psychologists tackle a wider range of mental health challenges. The right choice for you actually depends on your individual circumstances and needs and what you are struggling with. So take a moment to reflect on your needs before making any kind of decision. Here, I would love to speak on a query that one of my client been asked. So his question was with proper diagnosis, can an individual can regain sexual health or not? So a 30-year-old man he is, and he wants to know about the sexual fitness. He's eligible for marriage or not. So here, a sexual fitness profile test, it means that not only sexual health test, it is a diagnostic test that evaluates a person's sexual health and may help or identify any underlying sexual problems as well. So this mostly includes a physical exam, emotional evaluation, and some other blood tests. So if you go approach a doctor may order some blood tests to measure levels of testosterone, SHBG, blood sugar, cholesterol, and some thyroid hormones. See, this what I'm talking about, SHBG test. This test is often ordered if a person has symptoms of low or high testosterone levels, such as low sex drive, fertility issues, excessive body hair, or acne, or any kind of things. So testosterone test, low testosterone levels can cause the sexual problems such as decreased libido, low muscle mass, and increased body fat, etc. So penile blood flow ultrasound, Doppler ultrasound also been doctor may advise. All this tests will be done usually. So even though there is no foolproof or comprehensive medical test for assessing sexual fitness, however, you may do some laboratory, you may do the laboratory investigation to check your sexual status, like as I mentioned, hemogram, blood glucose, lipid profile, semen analysis. If necessary, they may ask for Regiscan or nocturnal penile also monitoring. So this to undertake the second stage level, along with the analysis of the semen or the sex hormones in the blood. So all this being done, and if also sometimes the gonadotropic hormone estimation from a blood levels also sample, and as I mentioned, ultrasound Doppler study of the scrotum also can be undertaken. Most important thing here is the physical examination is much important by your doctor. This will tell us whether clearly you have any structural abnormalities or birth defects which can affect your sexual or reproductive status. So I would say that with proper diagnosis and management, one can regain their sexual health. So I would love to hear from you all. Have you had any such experiences, from either with these professionals, getting confused? What are your thoughts on these differences between them? Drop your comments below. And if you want to learn more about the mental health topics, don't forget to check out my other videos as well. Thanks for watching and take care of yourself. Signing off, Shailaja Pisapati, clinical psychologist.